It's definitely been a journey of where I've started and where we're going moving forward. I've always had a focus on, how do we utilize technology to really improve on better patient outcomes. The reason why I'm working in healthcare is to truly make a difference too. And I think that's what a critical component is, because I always say in any speech or any specific item that I discuss, topics on, I always state that we all have a new CEO. I don't care what position you are in healthcare, we all have a new CEO. And that new CEO is the patient. And that's basically the bottom line. And as a technology leader for this organization, tools that benefit our patients both inside and outside of our organization, we're not going to be successful moving forward. And I always like saying too is that I'm a disruptor. I love disrupting items because I love change management, because it's so critical that our industry, healthcare, needs a massive change. I mean, we're one of the most antiquated industries out there, and that's such a sad thing. When you look at the oil and gas, when you look at the finance industry, there are many more years advanced when it comes to digital transformation than the healthcare industry. And we're doing the most important thing out there, and that's basically dealing with people's lives, changing people's lives, improving overall health. We should be leading the pack when it comes to digital transformation. That's such a critical component moving forward. And we've seen what happened during COVID-19. It wasn't because of your CIO, it wasn't because of your CTO, it was because of COVID-19 that really digitalized and started focusing on the core components of, creating better initiatives for an organization by incorporating technology as that core component to your overall organizational strategy, which has been so critical. And one critical component for myself too has always been, how do we change this culture, what healthcare has been built on? I did a discussion with Columbia University, and we were discussing about the brick and mortar theology of healthcare. So the way that healthcare has been built on this brick and mortar theology, very antiquated specific processes in place. And you figure, hospitals and clinics are digital companies that deliver healthcare services. We're living in the digital age of healthcare. So we have to act as a digital company moving forward. We have to get away from this overall brick and mortar theology and bringing the digitalization theology of what healthcare is basically built on moving forward. And I always say too, at the end of the day, that we have to tell the Flintstones to meet the Jetsons. And that is such an important thing, because you figure, our industry, healthcare, we need a massive revolution. This isn't just a technology makeover. This is a true business revolution. And when I say a true business revolution in healthcare, I really mean the fundamental shifts in the way healthcare is delivered and managed. Enabled by the transformational power of technology, as I always preach, and there's always been several key areas where I believe this revolution is needed, from patient-centric care, from data-driven decisions, from interoperability, telehealth, cybersecurity, the improvements of the electronic medical record system. And I could go on and on and on. But again, thank you very much for having me on this podcast, and I hope this is a good informed discussion here. In my opinion, the evolution of EHRs have really evolved significantly, transitioning from paper-based systems to a digital platform. I think some of the key milestones include the introduction of standardized formats, really increase interoperability focus. I mean, you figure we went from standard HL7s to more of FHIR API integration capabilities, which is a fast healthcare interoperability standard coming out of the HL7 group, which has been such a critical component of creating some true interoperability between specific systems. Because honestly, interoperability has been one of those buzzwords that have been a buzzword for many, many years, and we ask ourselves, are these specific systems truly interoperable? But I think really the increased interoperability focus with the utilization of FHIR has really improved the specific outcomes and the evolutions of the EHRs. And I think also, pushing from meaningful use to now promoting interoperability and really fostering comprehensive and standardized healthcare data is really critical. And I think this evolution has really improved. Also, the incorporation of artificial intelligence has been one of those key elements to really show the improvements of these systems, especially on a, on a standpoint of diagnostics, on a standpoint of verification, clinical decision support initiatives, utilizing artificial intelligence to incorporate into a radiology system. There's a lot of evolutions that this specific system has really just transformed to. But we also have to realize that the EHR is not the center of the universe. We as an organization really have to, even as an industry, we have to look outside the EHR. We need, a variety of specific tools to really continue to allow us to be successful in our overall digital transformational initiatives, which is so critical. The evolution, there's been a lot of key milestones to really evolve the overall EHR, and especially when we look at current state of EHR adoption. So in our organization, EHR adoption is robust. It really reflects the industry trends towards digital records. Over the past few years, there have been really a notable shift from healthcare providers really increasing and embracing EHR for improved efficiency, coordination, and better patient care initiative or spot for these clinicians, these EHR systems. And that's truly understandable because at the end of the day, I've always stated we need to let doctors be doctors, but I think also too, the current state of the EHR and the adoption of new things and really coming into the overall focus of what we're trying to do as an organization, we've seen a lot of more of these clinicians really embracing this specific system to improve better efficiencies. Because at the end of the day, we just don't want this specific electronic medical record system just to be a data depository, right? Just throwing in data. We have to have it as a valuable application and a valuable adoption for our clinicians to really help them improve their overall specific better patient care initiatives that they're trying to provide for these patients as well too. And as a technology leader, I have to make sure that we're basically putting in the proper technology in place to create better efficiencies for these physicians, allow them to, use this in more an efficient way to create better patient care outcomes, and also too to help reduce any type of burnout for these physicians as well too. I mean, if you look at this industry itself, we've seen how, the burnout rate has been so critical and such a major issue because as I stated, we just, we do not allow these doctors to be doctors. But the thing is though, is we can't also look at technology as a bad enemy or something that we just don't want to embrace. My personal opinion is that technology is one of those tool sets. It's not, of course, we talk about artificial intelligence and we see that there is some replacements with the use of AI. But the thing is, though, is I'm trying to tell people that the utilization of artificial intelligence is really going to create better efficiencies, better ways of taking care of our patient, better ways of reducing any type of burnout, better ways of just kind of allowing us to be more ahead of the curve when it comes to, the focus of what we're trying to do. That next generation healthcare organization with the adoption of artificial intelligence to improve the better outcomes of our patient spot for these clinicians, these EHR systems. And that's truly understandable because at the end of the day, I've always stated we need to let doctors be doctors, but I think also too, the current state of the EHR and the adoption of new things and really coming into the overall focus of what we're trying to do as an organization, we've seen a lot of more of these clinicians really embracing this specific system to improve better efficiencies. Because at the end of the day, we just don't want this specific electronic medical record system just to be a data depository, right? Just throwing in data. We have to have it as a valuable application and a valuable adoption for our clinicians to really help them improve their overall specific better patient care initiatives that they're trying to provide for these patients as well too. And as a technology leader, we have to make sure that we're basically putting in the proper technology in place to create better efficiencies for these physicians. Allow them to, use this in more an efficient way to create better patient care outcomes. And also, too, to help reduce any type of burnout for these physicians as well, too. I mean, if you look at this industry itself, in the end, we cannot completely replace the human element. Artificial intelligence as being more of that tool set. Yes, there is discussions in regards to utilizing artificial intelligence to create better clinical decision support initiatives, better ways of diagnosing specific patient conditions. I mean, there's a lot of focus in regards to that, but I always feel that there's always going to have to be that human element to create that personal touch for the actual provider and the patient itself. I think the primary challenges really include usability concerns and potentially disruption in workflow during implementation, which is always a problem. And I think, looking at some of these solutions is we have to look at, solutions involved in user-centered design, comprehensive training, and ongoing support to really ensure seamless integration into healthcare workflows.